Hello and welcome to the daily news analysis of the Hindu newspaper. Today there were about 4 to 5 important articles in the newspaper, so we'll be discussing them one by one. So the first and the foremost article is that the Union Cabinet has now decided that it will be providing free food grains to 81 crore beneficiaries which are covered under National Food Security Act. National Food Security Act for aims at providing subsidized food grain to the poor people, and it caters to 81 crore people. And now this extension of free food grains will be for another year till 2023 December. Okay. So what the government has decided that they'll be merging three schemes, namely Antyodaya Anna Yojana plus Pradhan Mantri Garib Kalyan Anna Yojana and this NFSA Act. So this scheme was launched during the COVID period. Because of pandemic, the livelihood of many people were impacted, and so government came up with this scheme which ensured 5 kgs of free food grains to the poor. Okay, every month. However, now these two schemes earlier used to provide subsidized food grain. Antyodaya Anna Yojana used to provide food grains to 1 crore poorest of the poor people, like the one who are in the bottom, the poorest of the poor. Okay, so now these beneficiaries will be getting free 35 kgs of food grains every month till December 2023. Okay, earlier, what was the price? It was like rupees 1 per kg for coarse cereal, rupees 2 for wheat per kg, and rupees 3 for rice. However, for another year, it will be for free. Now, this is a step which is for the welfare of the people, and the government standards that since they have adequate storage of food, they want to use that food grains for the betterment and benefit of the poor people. So, they have taken this step. Now, this step will cost government about 2 lakh crores extra expenditure for the implementation of this scheme, and obviously the subsidies. Okay. However, now this is debatable, and sooner or later we'll be having some editorials in the newspaper which will be discussing the pros and cons of this step, and then we'll discuss this further. Coming to the second article, now see, this article refers to the usage of drones in agriculture. Okay, this article in itself is not important for you to remember the name of this person or anything. However, it is good if you know, and you can use it as an example. So, since agriculture is one such sector where the employment in India is the highest, however, the outcome is not uh, replicating the involvement of people in it. So it needs a government intervention, it needs technological intervention, and hence it became a very important and potential question for prelims as well as for mains. Now, if we see prelims, question like application of drones, key what are the potential benefits of use of UAVs in agriculture, or as such also, then they can give you 1 point, 2 point, 3 point, and then you have to select which of them was the potential benefit of the drones. These kind of questions do come in the science and tech section. So in this way, this article is important. Second, you can also get in mains questions like what is the application of drones in agriculture. A direct question also you can get. Second, application of technology in agriculture. Like if you can also get a overarching question like this also. So you can use this as an example, use this as an idea for that question of yours, and sometimes in essays also. Okay, so what does this article say? So there's this person called CP Chandrasekharan who applied the use of drones into the agriculture, and he revealed that it can be of like it turns out to be a successful case study. Okay, so he did it for understanding the area, elevation, gradient of plantation, and then aerial spraying. Okay, so what are the potential advantages? We can get the real time information as we get it from satellites. uh, then we can also get the selective application of weedicides. See, fertilizers and micronutrients. This is very important, because if you see, when somebody spray weedicides, people used to carry something on their back and then they spray, farmers. Okay, what happened when they are spraying? Even if it is covered, in the face is covered, the mouth is covered, the particles of weedicides or fertilizers still manage to get inside their body, which is harmful for them. Okay, so if we can get this done through technology, machines, through drones, now it can be a very changing experience for farmers also, because it will be easy. Secondly, it will save them from the harmful impact of the weedicides and the fertilizer itself. So it is a very important application of drones. Second, it can also improve the agriculture practices. Obviously, if you can do things at a faster pace in lesser time, so it will definitely reduce your cost also, because it will reduce your labor cost. At the same time, drones has to be made available to the farmers in cheaper prices so that they can afford it, and their maintenance itself. Okay, so this was the purpose of picking up this article. Coming to the next article, so this is an editorial. See, there are three important sectors when it comes to India, which need utmost amount of care, priority, and investment if you want India to reap its demographic dividend and become a developed countries. And these three sectors are education, health, and agriculture. ठीक है, अभी इसीलिए, since they are important for India, uh, it becomes directly important for potential sectors of question for UPSC exam also. Okay, and you will always find a question from these three sectors, be it in your GS paper 2, be it in your GS paper 3, from agriculture, health, or essay. And you will find questions in prelims also from these three sectors. It can be in form of schemes, it can be in form of basic knowledge of these sectors, but you will, every time you will find question from these three sectors. Okay, now what this article says is, it talks about India's healthcare, which is largely driven by the private sector. So, private accounts for about 60% of overall expenditure on health, whereas the public expenditure is up to a percentage, as a percentage of its GDP is 1.28%, and total general health expenditure is 4.8%. So this is, if we compare it with the developed country, US, like US and China, it's very less, where it ranges up to 8 to 10% at least. Okay, now here it is important for India to invest in health, because health is responsible for out of pocket expenditure of a lot of poor people as well as lower middle class. Okay, so, and if you want to reap the advantage of the demographic dividend, you need to ensure that the health services are available first of all, and then they are accessible also, and that they are affordable. So there is this 3A criteria: available, accessible, and affordable. Okay, so government need to ensure that. And despite of the, now the article says is, despite of the fact that it is the private who is playing the majority role in Indian health system, it is the government who is always under the pressure to make it cheaper. So if private players are there, how can government make it cheaper? So this is something that we need to think about. So if you think of the COVID pandemic, we had seen that the cost of drugs like remdesivir going to skyrocketing. The poor were not getting access to the drug. There was a shortage of drugs also, and as a result, we didn't had the infrastructure to cope up with, even in fact the world didn't had, but still we were lagging behind. Then the private hospitals were very expensive and could not be affordable by the uh, poor people or even the middle class also. So it was later then the government intervention came, which capped the highest prices, and then there the prices were cut down, be it of vaccines and be it of drugs, be it of masks also. At one point, the prices of masks also skyrocketed. So this was one of the reason. Like, so what the article says is we need to regulate. It is the private sector pricing which needs to become which needs to be decreased. So how it can be done? See, in US they have a model of managed care model, which uh, which is there in response to the pressure which is created by the extensive cost of the healthcare. In India, how private sector deal with this? They do provide cheaper services. We do have private sectors hospital which are providing cheaper services on certain days, on certain period of time, in special OPDs, in special wards also. However, the quality gets degraded immediately of the healthcare. So at some point, hygiene is not taken care of. The drugs are not up to the mark and all that. So how do you deal with that? So if you think of the private healthcare or getting cheaper, one way is definitely public health insurance. But in India, if you see, do we have that penetration and the density of health insurances? No, we don't have. And that is why the government came up with the Ayushman Bharat scheme, Yojana. It's a flagship program, and which it is aiming at development of PHCs, getting insurances for to the poor people for the treatments and all. However, can we? Why not? This article pitches that why not make it affordable for everyone? Like, it will still be there for poor people, and the middle class will still have to face the burden of out of pocket expenditure, and then they have to go for this. The inflation is there, which will push them towards the poverty, if not below poverty line, definitely towards the poverty. So uh, what can be done to make it cheaper for everyone? Is why the people who can pay, should pay higher for the cheaper services. Okay, so they should also be getting at cheaper prices. So what is the need at this point of time? The article says is to make it affordable without affecting the quality. Okay, the need is that the private healthcare should be made affordable. Secondly, it can be done by overarching policies like promotion of innovation, promotion of R&D, creating systems like this Arvind Eye Clinic and Narayana Hrundalia. So what is this Arvind Eye Clinic is? This was this person who used to operate for cataract surgeries of eye. He developed a system where he used to cross subsidize or provided for or provide treatment for free. He used to rope in doctors who used to work in alternate days in paid wards as well as unpaid wards, free wards. So the doctors was incentivized because they were getting the work, and they were also getting the salaries out of it. Okay, secondly, he was able to provide free services to the poor people. His second method was he used to organize camps where he used to perform surgeries for free, and the expenditure of camps were taken care by the organization in association with whom he has done this, organize these camps. So in this way he has been able to develop a system where poor can also get good services without getting the hampering the quality. Okay, so these are some kind of system that can be developed, that can be taken looked into, and these are one of the most appreciated model. But the article says although these sort of systems are there, but they are still limited to the philanthropic organization. Why cannot we replicate the same in the private models where they can take from the people who are paying and get it and provide it for free to the people who can't afford it without affecting the quality of service? If that can be done, it will be a very good step in bringing down the expenditure of in the health. Okay, so that's it for this article. Let's move on to the next article. Before going to the next article, I have given you two practice questions. So one is one country, two systems. A phrase generally seen in news is related to which of these two countries? Israel, Pakistan, China, Hong Kong, United Kingdom and Ireland? None of the above. Okay, so and then we'll discuss about this later, but you please answer this question. Second is consider the following statement with reference to INCOVAC. So it stands for intranasal COVID vaccine. So it is co-developed by Hyderabad-based Bharat Biotech and US-based Washington University. Second, it is a nasal vaccine. As the name suggests, intranasal COVID vaccine. It is a nasal vaccine, and in fact, it is the first nasal vaccine which have been approved for use. Second, it is co-developed by Hyderabad-based Bharat Biotech and US-based Washington University. It's absolutely correct statement. So the answer of this question is C. See, the question that we asked in the previous slide, one country, two system. These type of question can be asked by UPSC, and it does ask question like that in prelims. Okay, it is not relevant for mains at all, and it is the only important question which can be asked from this article. No second question can be asked from this article. Further, it can be asked in your interviews for the interview going students. Okay, they can ask you about what do you think of China Hong Kong situation and all that, but it is less likely. Okay, however, why we are discussing this article first of all? So it is Xi Jinping who said that he is going to abide by the governing principle of one country, two systems for Hong Kong, which is important from prosperity and stability of the city. Okay. Now what happened? It was put in place in 1997 for 50 years, which ensured that the Hong Kong, after still being a part of China, will still be able to retain its own political China, for social and financial institutions for another 50 years. However, Xi Jinping tried to bring in some change or alter the situation, but he couldn't. So he again came back to the previous principle. That's it in this article. There's another article which is about DRDO. In this article, CAG put a report named as Management and Outcome of Mission Mode Projects in DRDO. Now, the report said uh, there were about 178 projects which were given to DRDO to cover them in a mission mode. However, out of those 178 projects, it was in 119 projects that the original time was not adhered to. Okay, some projects even took time of about 500% of the original time that they were allotted. Okay, so, CAG pointed out, if this is the amount of extra time that you are taking to cover a project which was supposed to be in mission mode, then the entire purpose of completing a project in mission mode gets defeated. Secondly, out of 86 projects who were declared successful, in 20 projects, one or more key objectives were not met. So, if in a project you have not met the objective, how can you declare that project successful? Now, the question is, why are we discussing this article? Standalone, this article is not as such important for any standalone question. However, you can use this data in case there is any question that critical analysis of defense industry or something of that sort of thing. If there, you can use it in some essays which are there on Indian defense or something like that. In those questions you can uh, give an give this as an example where you can actually highlight why we are not there where we should have been in when it comes to defense expenditure. There are a lot of expenditure that is being made into defense. However, if we are lagging behind, then we cannot meet the targets that we have for ourselves. So that's it for today. See you again next time. Thank you so much.